Hello everyone, and welcome back to our channel where we explore important topics that touch our lives every day. If you're new here, consider subscribing to stay updated with our latest videos. Today, we're diving into a crucial topic in the care sector: safeguarding and whistleblowing. Let's break it down in simple terms and explore some real-life scenarios you might encounter. Ready? Let's get started. What does safeguarding in care mean? Safeguarding is all about protecting people's health, well-being, and human rights. It ensures that individuals, especially those who may be vulnerable due to age, disability, or illness, are free from abuse, harm, and neglect. Understanding safeguarding. Imagine you're working in a care home, and you notice something isn't right. Maybe a resident isn't being treated with the respect they deserve, or you see signs of neglect. Safeguarding is your tool to step in and ensure the right measures are taken to protect that individual. What is whistleblowing? Whistleblowing in care involves reporting concerns or suspicions about unsafe or illegal practices within a care setting. It's about speaking up to protect those who can't protect themselves. The role of whistleblowing. Whistleblowing might seem intimidating, but it's a powerful act of courage. If you witness abuse or malpractice in a care setting and report it, you're not just a bystander. You're a protector of the vulnerable. Situational questions and answers. Question 1. You're a caregiver and notice a colleague verbally abusing a resident. What do you do? This is a clear case for safeguarding. Report this to your supervisor immediately. It's important to document what you've witnessed as accurately as possible. Question 2. You see a fellow staff member handling a resident roughly. No one else seems to have noticed. What's your next step? Answer. This is where whistleblowing comes in. Report the incident through the proper channels in your organization, and ensure the resident's safety is prioritized. Question 3. A resident confides in you that they feel neglected and isolated. You haven't witnessed this firsthand. What should you do? Answer. In such a scenario, it's important to listen and take the resident's concerns seriously. Report this to your manager or the safeguarding lead. They will investigate further to ensure the resident's needs are being met. Question 4. During your shift, you discover that certain medications are being administered incorrectly. What's the correct course of action? Answer. This situation calls for immediate action. Incorrect medication can have serious consequences. Report this to your supervisor and, if necessary, escalate it through the whistleblowing policy to ensure patient safety. Question 5. You overhear a conversation indicating financial exploitation of a resident by a staff member. You're unsure what to do, as you have no concrete proof. How do you proceed? Answer. Even if you don't have proof, this is a serious allegation that needs to be addressed. Report your concerns to your manager. They will initiate an investigation to protect the resident from potential financial abuse. Question 6. You're a nurse in a care home. One evening, you witness a colleague accidentally injuring a resident but failing to report it. What should you do? Answer. In this case, it's essential to report the incident yourself. Not reporting an injury, even if it's accidental, can lead to serious consequences for the resident's health and violates care standards. Question 7. You discover that a member of the administrative staff is misappropriating funds meant for resident activities. You have evidence to back your claim. What's your next step? Answer. This is a clear case for whistleblowing. Report the issue to a higher authority within the organization, like a manager or the compliance department, and present your evidence. Question 8. You learn that a fellow caregiver is covering up a medication error that could harm a resident. You overhear them discussing how to hide this mistake. What action should you take? Answer. It's critical to report this immediately to your supervisor. Covering up a medication error can endanger the resident's health and goes against healthcare ethics and regulations. Question 9. You realize that several new staff members are providing care without proper training or qualifications. This is not being addressed by your superiors. How do you handle this? Answer. Report this issue through the whistleblowing channels in your organization. Inadequately trained staff can lead to substandard care and risks to residents' safety. Question 10. A colleague is sharing confidential information about residents with unauthorized individuals. You've noticed this happening more than once. What should you do? Answer. This is a serious violation of privacy and trust. Whistleblow by reporting it to your management or through a confidential reporting system, if available. If you found this video helpful, give it a thumbs up and hit that subscribe button for more invaluable career advice. Best of luck in your job hunt.